Okay, get this. What if we could fight one of the most aggressive skin cancers out there, not with scalpels or radiation, but with sound? It sounds like science fiction, right? Well, a brand new study dives into exactly that, and it's proposing an incredible new way to treat melanoma by swapping light waves for sound waves. Let's dive in. And this research really couldn't have come at a better time. That number you're seeing? That's how many new cases of melanoma we're expecting just in the United States for 2024. It's a huge challenge, and it's one that demands totally new ways of thinking, like the one we're about to explore. So to really get our heads around this, here's how we're going to break it down. First, we'll look at the melanoma challenge itself. Then, we'll check out an existing therapy that uses light. After that, we'll get to the main event, the new sound-based solution, see how they put it to the test, and finally, reveal the pretty groundbreaking results. All right, section 1, the melanoma challenge. Because, before you can really appreciate a clever solution, you've got to understand the problem it's trying to solve. So, at its heart, cutaneous melanoma is a really serious type of skin cancer. It starts in these specific cells called melanocytes, which are the little factories that produce the pigment or color in our skin. And that little detail, the pigment, is actually a super important piece of this puzzle. Keep that in the back of your mind. Now, our standard treatments like surgery, they can definitely work, but they've got some major downsides. We're talking about scarring, which is a big deal, especially on sensitive spots like your face. Plus, the sheer stress of surgery can actually weaken your body's own immune system. And other big guns like chemo, well, sometimes the cancer cells just learn to tolerate them. This is exactly why the hunt is on for better, less invasive options. And that hunt brings us to an existing alternative, one that tried to fix some of these problems by using light. But as we're about to see, it has one critical, fatal flaw when it comes to melanoma. This treatment is called photodynamic therapy, or PDT, and the idea behind it is actually pretty cool. You give the patient a special drug that only gets activated by light. Then you shine a specific wavelength of light right on the tumor. This flips a switch in the drug, causing it to create a kind of weaponized oxygen that just obliterates cancer cells. It's like setting off tiny, targeted explosions on a cellular level. It's a simple recipe, right? Drug plus light plus oxygen. But, and this is a huge but, here is the problem. Remember that pigment we talked about, the melanin? Well, in melanoma, it basically acts like a natural shield, blocking the light. This means the light just can't get deep enough to switch on the drug where it needs to. So the therapy is at its absolute weakest against the very cancer it's supposed to be treating. It's a frustrating paradox. So, if light is the problem, what if you could just swap it out for a totally different kind of energy? And that question, right there, leads us to the big aha moment in the lab, a solution based on sound. Say hello to sonodynamic therapy, or SDT. Now, does that look familiar? It should. The principle is almost exactly the same as PDT, but instead of a light-activated drug and visible light, you use a sound-activated drug and low-intensity ultrasound. And this comparison just lays it all out perfectly. Where visible light gets stopped in its tracks by skin and pigment, ultrasound waves, the same kind they use to look at babies, they sail right on through. They can get deep into tissue, and they could not care less about that melanin shield. This, right here, is the potential game changer. Okay, so a great idea on paper is one thing, but does it actually work in practice? Well, that's exactly what the researchers needed to find out. So let's get into the key experiments where they really put this sound-based solution through its paces. They boiled it down to 3 really essential questions. First and foremost, does this thing even work on tumors at different depths? Second, what if you combine it with the old light therapy? Do you get some kind of super treatment? And third, a really practical question, what's the best way to actually deliver the sound waves? And that brings us to the most exciting part of this whole story, what the science actually revealed. The results are in, so let's check out the answers to those 3 big questions. So let's tackle that first crucial question. Does sonodynamic therapy pack the same punch on both shallow and deeper early-stage melanomas? Wow, just look at these numbers. The results are seriously compelling. Compared to the control group, which obviously had 0 effect, SDT slammed the brakes on tumor growth by almost 87% in the shallower tumors. And even in the deeper stage 2 tumors, it still managed to shut down growth by over 72%. These are really, really impressive results. So the main takeaway from that first experiment is just a huge, resounding yes.
The sound-based therapy worked incredibly well no matter how deep the tumor was. It proved once and for all that ultrasound could completely sidestep that penetration problem.
Okay, on to question number 2. Now, common sense would tell you that if both therapies work on their own, mixing them together should be even better, right? Hit the tumor with a 1-2 punch of both sound and light. And this is where the story takes a fascinating turn. The data told a completely unexpected story. So light therapy by itself stopped growth by about 53%. Sound therapy, as we just saw, was way better, clocking in at 86.5%. But the combination? Get this. It was actually less effective than sound therapy all by itself at just over 79%. So what the heck is going on? Well, it was a total surprise. Instead of helping each other, the two therapies were antagonistic. They literally worked against each other. The scientists think that the first treatment, the sound therapy, was so effective that it used up all the available oxygen inside the tumor, leaving nothing behind for the light therapy to work with. Which brings us to our last question, the practical one. We know the sound works wonders, but what's the best technique to get those ultrasound waves where they need to go? The researchers tried out 2 main methods. One used something called a waveguide, which is kind of like a funnel that focuses the sound energy. It's perfect for targeting small, specific tumors. The other method was just direct contact with the ultrasound probe itself, which turned out to be more energy efficient and a better fit for larger tumors. So the bottom line is, both worked, it just depends on the situation. The study authors really summed it up best themselves. They conclude that this sound-based therapy shows real, genuine promise for treating melanoma, and that this research is a huge step toward actually getting it into clinics to help patients. And that leaves us with this final, really cool thought to chew on. Maybe the future of fighting cancers like melanoma isn't just about what new drug we discover, but about what kind of wave we use to turn it on. Could the ultimate weapon be less about pure chemistry and more about physics? Just finding the right wave for the job?